Hi, my name is Andrew Richards and today I'm speaking from well-aligned Cammeray. Today I want to talk about EMG biofeedback. It's something that we use all the time in the practice and it's been very useful. What it allows us to do is to measure the electrical activity in a muscle group. And better still, when we've got two channels, it allows us to measure the activity in one muscle group compared to another. And that's where it becomes very useful. So when we're looking at muscle patterning, balancing, reprogramming, strength and conditioning, we really need to know what's going on with those muscles, when they're switching on, when they're switching off, and how they're working relative to each other. A classic example is someone who comes to us and says, oh, I've done a glute activation program, my glutes are as strong as possible, but I've still got the hip or the back pain or the problems that I'm having with pelvic instability. And they feel like they've executed their program as best they can and don't understand why. And so a lot of times when you look at technique, you could have great form. So someone could have a really nice squat, in actual fact, not be using their glutes well at all. And especially when we look at the activity, maybe using the glutes well as they come out of the floor, but actually not using the glutes well on the way down when they're trying to control that lowering into the floor, where a lot of the shot comes in when you're running and landing on one foot. So the EMG takes all the guesswork out of it, allows us to really refine our programming and have some accurate benchmarks to measure, so the guesswork gets taken out of it. I wouldn't be without one. It's just one of those things that you just can't do accurately by feel, and you just can't track change and progress very well without it. So that's EMG biofeedback. If you've had problems in any area actually, whether it be the shoulder, your neck, your low back, your hips, the knee, and you feel like you've executed a rehab program but haven't got the result you're after, maybe an EMG assessment might be the way to have a closer look at how we could refine and tweak your programming just so you get the best out of it.